Hare Krishna. This is Yogaraj from Bhaktivedanta Hospital and Research Institute. Welcome one and all for the today's podcast, which is on early detection saves life, which contributes to saving lives through early diagnosis. Bhaktivedanta Hospital and Research Institute is a 300-bedded multi-speciality tertiary care NABH aggregated hospital which is located in Mumbai Mira Road. We offer holistic healthcare services for body, mind, and soul with the advantages of allopathic, Ayurvedic, homeopathy, and alternative medical therapies under one roof. This podcast is under our flagship program titled ISKCON Devotee Healthcare Services, which was launched at Mayapur in the year 2023. Through this program and through this initiative, we were fortunate to got the opportunity to serve more than 4,500 devotees. This enlightening session is streamed on Hare Krishna TV YouTube channel. We are honored to have Dr. Ankush Govindar, His Grace Anand Madhav Das, our esteemed consultant and head of radiology department, gaining 10 plus years of experience. He will delve into the profound science of imaging test and share his expertise. So let's begin our live talk show. Hare Krishna Prabhu.
Hare Krishna.
So Prabhu, we are thrilled to have you today. To begin with, could you tell us a bit about yourself and the journey in the field of radiology?
So, first of all, thank you for having me here. So, my journey has been fascinating in the sense that when I started to have a desire to become a doctor, when one of my uncles he got very sick, actually,
Okay.
and he was miraculously saved by a doctor.
Mhm.
And when I saw that, I thought, no, I have to become a doctor.
Correct.
And when I get into the MBBS course,
Mhm.
but then when I studied the organs, I realized very important fact. A fact that the organs they behave in a particular way,
Mhm.
and they have that tendency in a disease process they get abnormal,
Correct.
and we have that window period where we can get to that abnormality before it breaks out.
Correct.
So that fascinated me a lot, and radiology is all about that,
Mhm.
getting the diseases in time,
Correct.
to diagnose so that we save lives.
Correct. Right. So, most people know about reading the scans, but what does day to day actually it involves in radiology?
Yeah, actually, radiology is not just like reading the scans.
Mhm.
We do deal with patients like other doctors.
Correct.
A radiologist is a specialist doctor
Mhm.
who takes care of the patient. You can say who takes care of a holistic way of patients. The entire diagnosis, the entire pathology.
Right.
So a radiologist is seeing into the body
Mhm.
through different modalities.
Correct.
So we have four main modalities like
Mhm.
X-ray,
Mhm.
CT scan,
Mhm.
sonography, and MRI,
Correct.
as well as few supplementary modalities like DEXA scan, like PET scan,
Mhm.
and like mammographies. So through these modalities, we try to peep into
Hmm.
the body what is happening.
Hmm.
So this is what a radiologist is. Yeah.
Hmm. Correct. Right. So, when should someone think about getting screened, even if they feel they are healthy? Can radiology detect issues before symptoms even start showing?
So yeah, this is a very important and this is very powerful question, I say, because this is one of the myths
Hmm.
amongst us today, that whenever we get the problem, we should go to the Department of Radiology for screening.
Correct.
But that's not the case. Actually, our body gives soft signals as well.
Mhm.
So before the body, starts screaming,
Yes.
like having fever or having acute pain in the abdomen or
Hmm.
having many other different varieties of severe symptoms,
Right.
one should go to the radiologist,
Mhm.
and one should get his or her body screened. So
Correct.
what do I mean by get the body screened? So basically radiology offers a battery of services right from head to toe. So basically, when I say the soft signals of the body, it means that, for example, see you have some genetic disorder,
Mhm.
or you have some diabetes,
Correct.
if you see that your blood pressure has increased, or you say your blood test is showing some hypercholesteremia, I mean that fat content in the blood is more, or let's say you have a lifestyle which is not very healthy,
Mhm.
or stressful, your sleep pattern is not good,
Right.
and you deal with corporate world where there is a cutthroat competition.
Correct.
So these are the soft signals,
Hmm.
and such persons, such people, he or she should get her or his scan done.
Correct.
Yeah.
Correct. Right. So let us talk about some understanding of common imaging test.
Okay.
Let's start from mammography.
Okay.
So let's talk about breast health. Who should get a mammogram and how often one should undergo?
So whenever I'm asked about mammography, my heart goes towards those underprivileged and those people who really don't get to screen themselves
Hmm.
before they are diagnosed in stage 3 or stage 4 cancers. So that is the sad reality in India. See, if you see the Western world, if you take the example of Europe, or if you take the example of the US, or even in the South America,
Hmm.
so there, what the government has done is they have compulsorily imposed a rule.
Mhm.
Like, for example, government gives some so many perks.
Right.
So they will not get those perks. Those who will not undergo the screening mammography test.
Okay.
And what is the benefit of that?
Hmm.
Because they screen it every year after the age of 40,
Mhm.
the breast cancer that is detected in them
Hmm.
is detected at a stage of stage 1 or stage 2. So what is the difference? See, if we detect at stage 1 or stage 2,
Mhm.
we have full power in our hands to remove it completely from our body. So
Absolutely.
what happens is, in India, unfortunately, because of the lack of awareness in people,
True.
people don't come for screening. Then what happens? Whenever they come, the mass or the breast mass, the cancer, it has become so big
Hmm.
that it is not only present in the breast, it is present in the body. That's a sad story. And then what can a surgeon do? Surgeon can take out the breast, cancer from the breast, but the cancer is spread to the liver, to the bones, to the blood, to the brain, to the lungs. It becomes very horrible story.
Correct.
So through this medium, I would like to urge our viewers that please do not neglect this fact.
Right.
Every woman after the age of 40,
Okay.
deserves, if some woman wants to give a gift to herself, it will be a very good gift that one
Absolutely.
should undergo a mammography scan.
Correct.
And then one more important thing I would like to tell.
Mhm.
So not that okay, you have to undergo a mammogram.
Hmm.
There are different types of mammograms
Correct.
in market. You see that majority of the mammograms, they are like conventional.
Mhm.
What do you mean by conventional? That they a particular millimeter below that they will not detect the cancer.
Correct.
But for the benefit of society in general, Bhaktivedanta Hospital, the Department of Radiology,
Hmm.
has got a state of the art new direct digital hologram hologic selenia machine.
Correct.
So what it does is, it is first of all very ultra low dose.
Mhm.
Yeah, one more question about mammography they ask is the dosage radiation of the.
Right.
So I'll say that the radiation dose of a mammogram
Hmm.
is less than a radiation you will get if you fly from Mumbai to New York. So, but people, they ask this question. So I will ask them a counter question,
Hmm.
that what is the cost if we don't undergo the mammogram?
Correct.
What if we don't detect the cancer in an early stage?
Mhm.
Now our lifestyle and habits are such that the cancer is bound to come,
True.
but in our hand is that one strong powerful modality that we should take use of it.
Correct.
We should make use of it.
Right.
So I was talking about the direct digital mammogram. That is, it is ultra low dose. Second thing, women, they sometimes fear that it is painful. you know it is not at
Yes.
all painful. Actually, it is painless. In conventional mammography, the breast gets compressed.
Mhm.
That's why it may be painful. But in direct digital radiography, like this hologic selenia,
Mhm.
which are the pioneer in the woman's imaging,
Correct.
it is almost painless.
Okay.
So you can expect that there will not be any pain.
Mhm.
And thirdly, it is very cost effective.
Correct.
So please make best use of this opportunity, and please come to the Department of Radiology for mammography.
Very rightly said, sir. So, is there any age particular or women can do at every stage? Because you mentioned
Yeah,
40 plus.
it is very important question, because not anyone and everyone can just walk in.
Okay.
and get her mammogram done,
Mm-hmm.
because there are some there are some issues with the breast density, as
Okay.
well as there are some radiation issues.
Mm-hmm.
So women less than 40 years of age,
Okay.
they have very less chance of developing breast cancer, first of all.
Mm-hmm.
And second of all is that ultrasound of breast
Mm-hmm.
is a better alternative for women less than 40 years to detect
Right.
cancers,
Right.
because they are anyways having less chance of having cancer. So literature, the white papers, the scientists who do all the research work,
Mm-hmm.
they have proved that the effectivity of a mammogram after the age of 40
Mm.
is more than less than 40.
Okay. What about lactating mothers?
Yeah.
Can they undergo mammography?
Yeah, so basically if the woman is more than 40 years of age
Mm.
and the woman is lactating, then she can undergo mammography, and there is no harm in feeding the fetus,
Mm.
but under the directions of a physician.
Physician.
Yeah.
Correct. Right. So let's move on to the next common imaging test, that
Okay.
is DEXA scan. So what is DEXA scan and how is it most useful and for whom?
Okay. So whenever we say DEXA, some people might say that what is this DEXA? It's a very weird name.
Right.
So it's a short form of dual energy X-ray absorptiometry. It is nothing but bone mineral densitogram,
Mm-hmm.
which used to be in the previous years, but now it has gone to a very different level, very high level,
Correct.
because here we are not only measuring the bone density,
Hmm.
but also the entire body composition.
Correct.
So what happens in a DEXA is a very low dose
Mm-hmm.
of X-ray is passed through our body
Mm.
into the DEXA machine, through the DEXA machine.
Okay.
And what happens is that X-ray travels into the body and
Mm.
calculates
Mm.
the densities
Mm.
of different tissues of our body.
Correct.
So basically, the bones, which are very strong, supposed to be, but those people with vitamin D deficiency or calcium deficiencies,
Mm.
their bones are less powerful.
Okay.
They are fragile.
Correct.
They can break at
Mm.
any point of time. So how weak your bones are, this test is very good.
Okay.
At the same time, this test can give you the muscle composition, lean mass.
Okay.
Here what happens is, now people are getting aware that the nutrition, the nutrition value of the Indian diet,
Mm-hmm.
in which carbohydrates are more,
Correct.
proteins are less.
Right.
So this has been the cause of concern since the last maybe a decade or so.
Mm. Mm.
So what happens is, because of the less proteins, the muscle mass is less.
Correct.
That we call in medical term as sarcopenia.
Mm-hmm.
So this test is a powerful test, diagnostic test, to diagnose sarcopenia.
Okay.
And the other thing is the fat composition, which is always a question in this scenario,
True.
of this altered lifestyle,
Mm-hmm.
and people dying of obesity, diabetes. So this test becomes a powerful test to even understand the fat composition of the body.
Okay.
And then where we should undergo the DEXA scan, again there are conventional methods as well as
Yes.
modern techniques.
Right.
So in the modern technique, the pencil beam or ultra fast beam of the X-ray is passed to the body.
Mm-hmm.
And you'll be very happy to know, our viewers will be very happy to know, that we have installed such a state of the art modern the DEXA machine,
Right.
which is also cost effective, and
Mm-hmm.
people should take advantage of this opportunity
Hmm.
and get their scan done. Who should go undergo this DEXA scan?
Yes. Yes.
Are you going to ask the same
Yes.
question next?
Yes.
Yeah. So basically, first of all, even children can undergo. Any age group, there is no bar.
Okay.
But those who are having their menses are stopped. For
Mm-hmm.
women,
Hmm.
we call it as post-menopausal.
Right.
The periods are stopped. So there, what happens is the hormones, they get depleted, and because of that, the bones become weak.
Correct.
So for them, it is very important. Also,
Okay.
people who are old age
Mm-hmm.
and they are suffering from metabolic syndrome. What is a
Correct.
metabolic syndrome? It is a constellation of diabetes, blood pressure, cholesterol, and all other things.
Hmm.
So those who are having that, they should undergo this scan.
Okay. Great. So we have the DEXA scan facility available at Bhaktivedanta Hospital as well. So let's talk about sonography, that is
Yeah.
ultrasound.
Yes.
So ultrasounds are often associated with pregnancy for our layman people.
Yeah.
But what are the other health conditions that can detect early through ultrasound, that is
Yeah,
sonography?
definitely. Ultrasound or sonography is is I can say the best boon that a modern man has got,
Correct.
in this last 40 50 years.
Hmm.
So what it does, it is a sound wave, as the name suggests, ultrasound.
Hmm.
The sound is there, but it is at a very high frequency,
Correct.
which is not audible by our human ears.
Mhm.
So what happens is this ultrasound probe,
Hmm.
it generates these sound waves, and the sound waves, they go into the body, they enter the body, and what happens is they come back from the body, get reflected into the probe and into the machine, and they generate this image.
Okay.
Why it is a boon, I say? See, we talked about mammogram and we talked about DEXA. Both are based on radiation.
Hmm.
Even though I say that they are very low dose, but still they have some radiation. But here, if you see about ultrasound, they are completely radiation free. They practically don't have any side effect on body.
Mhm.
And what can we scan? Only the pregnant ladies? No, not at
No.
all. From head to toe,
Hmm.
all the scans are possible in a ultrasound or sonography machine.
Correct.
So what happens right from head region, if I say
Hmm.
head and the neck region, what
Hmm.
happens is sometimes the patient gets stroke or paralysis.
Hmm.
So what is the root source of that paralysis? We screen the neck vessels and we also screen the brain vessels
Mhm.
through the ultrasound.
Okay.
And then somebody has a thyroid problem,
Hmm.
we screen their thyroid gland
Hmm.
through the ultrasound. Somebody has this nodes problem,
Correct.
so we get the tonsils and the nodes,
Hmm.
so we screen them through ultrasound.
Correct.
And if you talk about the chest, we get sometimes the our chest gets filled with fluid or water.
Mhm.
We call it pleural effusion.
Okay.
So to take out that fluid, we use ultrasound. To estimate the volume of the fluid, we use ultrasound. If
Correct.
our lungs are in a good shape and good aeration, we use this ultrasound. At the same time, if you see the abdomen, most of the people, they know sonography because they had acute pain in abdomen
Mhm.
and they go to the doctor. The doctor prescribes them, oh, you have to undergo this sonography test.
Right.
So what we detect from a sonogram, we can detect any problem in the liver, like liver abscess, or we can detect the problem in the pancreas, pancreatitis, in the spleen, gallbladder stones,
Stones.
and then we have appendix,
Correct.
then we have stomach infections, and then bladder infection.
Hmm.
We call it as urinary tract infection or
Correct.
urine infection.
Mhm.
All these tests. Along with that, sometimes we get pain in our legs and calves, while walking.
Mhm.
Or we call it as claudication pain. Why it
Okay.
is like that? Because there is some insufficiency or decrease in the blood flow to this, lower limbs or legs, we say.
Correct.
So through the color Doppler facility,
Right.
we get to know about the health of these arteries and the veins of the legs,
Right.
also varicose veins.
Correct.
And apart from that, as you have already aptly mentioned, that these obstetric patients, like the pregnant patients, we get to see
Mhm.
what we cannot see through the naked eye. What do you see? We get to see the 3D structure of the
Hmm.
baby inside the belly.
Correct.
So we get to see the eyes, the nose, the lips, and the entire limbs of the fetus, which
Right.
when the parents they see, they are fascinated by it. Yeah,
Correct.
yeah,
Correct. Right.
yeah.
So, when you spoke about this color Doppler test, how does it help to detect like the clots and the circulation problems?
Exactly. Very nice question. So, what is a color Doppler? So everyone says, or few patients who don't know much about color Doppler technology, they say,
Right.
"Ki, sir, please do it in color. We don't want it in black and white." So
Right.
actually, the radiology field is 50 shades of gray. We have different shades of gray, but then our life, to make our life colorful,
Mhm.
to make the life of a radiologist colorful,
Right.
we have this color Doppler. What is a color Doppler?
Hmm.
So color Doppler is a special technique where, see, all of our organs are supplied by the heart.
Hmm.
Our heart pumps,
Right.
and that pipelines, they go to the brain, to our limbs, to our body, to our legs,
Mhm.
everywhere.
Hmm.
And these pipelines are called as arteries and veins. Pipelines are very important.
Correct.
For example, the water pipeline coming to our house, if that pipeline gets blocked, so we'll not get water to drink, water to bathe, and so many different things.
Right.
So this is very important, that our pipelines of the body, the arteries and the veins, the arteries, what they do is they carry the blood from heart into the organ, and the veins, what they do is they drain that blood which is used by the organ,
Right.
back into the heart, then into the lungs to purify it.
Right.
So what happens is, whenever there is some obstruction or blockage in that pipeline, the blood which is supposed to go from heart to the organ does not go
because of that clot.
Because of that clot.
Correct.
Then what happens is, the organ starts malfunctioning or suboptimally functioning. And then if that organ is very important, like brain, then one may be at risk of developing a paralysis or stroke, where one or different parts of the body, they stop functioning. Or if the organ is like lower limbs, we have pain in walking, as I told, claudication pain. So all these things. So by color Doppler, we get to know the health of the pipelines.
Correct.
And the pipelines will not be an exaggeration to call these pipelines as lifelines.
Correct.
Because if these lifelines are blocked, then everything is blocked.
Absolutely. Correct. So we'll take one question which we have received from our participants.
Okay.
Are there any dietary restrictions before the procedure?
Very, very important question. So different procedures have different precautions to be taken. Like, for example, we have not yet discussed about CT scan.
No, we haven't.
Yeah. So for CT scan, there are particular instructions, like we should undergo a blood test called as serum creatinine to know the health of the kidneys.
Right.
If the health of the kidneys is normal, then we can undergo the CT scan. For sonography, yes, if you want to undergo a sonography of an abdomen, and especially if you want to see the gallbladder, the gallbladder, as you know, functions very well when our food is taken into the stomach.
Correct.
If it functions, then it secretes the bile, then it becomes empty.
Correct.
Then we cannot see the gallbladder.
True.
To see the gallbladder has to be completely distended. That means our stomach has to be empty.
Correct.
So we advise or advocate 2 hours of fasting before the scan for gallbladder, and for the female patients or the women who want to see the pathology in their uterus or ovaries, we advise them to have a full bladder. So that a full bladder means urinary bladder. So we have to drink the water and we have to feel the pressure. We want to go for urination. These are the prerequisites. Otherwise, almost you can say there are no such other prerequisites like that.
Correct. Yeah. So when we are talking about CT scans, so what are the commonly recommended CT scans, and what exactly a CT scan and when it is needed?
Correct. So before that, I'll just have a quick discussion on an X-ray, because CT scan is based on the X-ray. So an X-ray is a technology developed by, it was the first technology in radiology, which was first discovered by Roentgen. And then it was further developed by all other scientists into a modality where we just expose a patient to the radiation or the X-rays. And then what happens is that radiation, they pass through the body and an image is formed. That image is a 2D image, you see. Okay. So like a painting. Right. So there we can peep into the body, but only in the two dimensions. It is sufficient for screening chest or seeing the fractures of the bones. But for a complicated disease process, we need a 3D scan. Okay. And then this another boon in the modern medicine, we can say, the CT scan. What is a CT? It's a computed tomography. Computed means it's a computational algorithms involved in it. And tomography, tomo means body. Correct. Graphy means to visualize. So we visualize the body in a 3D format. So we see bit by bit all the tissues and the organs, and then we visualize the in and out of the entire organs of the body through CT scan. Correct. So your question was?
CT scans are commonly recommended by radiologists, but what exactly is a CT scan and when it is needed?
Yeah. So yes, basically CT scan is very, very important in the emergency situations. And the main use of CT scan, you can say, is it in the emergency situations. Like, for example, a patient comes with a stroke or a paralysis to the emergency department. The first scan they do is a brain scan of CT scan.
Correct.
If a patient comes with acute pain in abdomen, we cannot wait for a sonography to be done. We directly take the patient for a CT scan.
Correct.
So all these acute emergency conditions, CT scan is helpful.
Mhm.
Also, CT scan is very useful in many preventive diseases.
Correct.
Like for example, you have pneumonia or
Mhm.
some lung infection
Mhm.
where there is fever in the body, and the patient is coughing.
Correct.
Like we have a very unforgettable and unpleasant memory of COVID-19 for the 2 years.
Very much.
So people they were very fearful what is happening in the lungs, and our pulmonologist, those specialists in the lung diseases, they heavily relied on the
Correct.
CT scan.
Right.
So each and every patient used to undergo a CT scan,
Mhm.
and just to see that how much disease burden of COVID-19 is there inside the lungs.
Correct.
So all other lung infections, lung malignancies like lung cancers, and then all other diseases processes of abdomen,
Mhm.
as well as angiography.
Right.
All these things are covered in a CT scan.
Okay. Right. So, what is the difference between CT scan and CT coronary angiography?
Yeah, this is also very frequently asked question. Actually, very important. CT coronary angiography is a type of CT scan. Actually, CT scan has two main types.
Mhm.
One is a plain CT scan, and one is a contrast enhanced CT
Contrast.
scan.
Yes.
So plain, you can say it's a black and white painting,
Mhm.
and contrast enhanced, it's a colorful painting. So whenever we push
Hmm.
a dye is a routine dye which we know of, any colorful dye.
Right.
Ours is a colorless dye. It is iodine based dye that
Mhm.
we push into the body through the veins,
Right.
and then what happens, it goes into the heart and
Mhm.
into the entire body, and then it creates the enhanced image of that organ,
Mhm.
and we get the functionality of that organ also.
Okay.
So basically we create an angiographic image. What is an angiography then?
Mhm.
So many times patients ask, what is an angiography? Because patients know of angiography only of a coronary angiography of cath
Coronary.
lab by cardiologist.
Yes. Yes.
Angiography can be done of any organ.
Hmm.
It is done basically with the help of a CT scan as well as with the help of a cath lab. Cath lab is a invasive test which is done by an interventional radiologist
Right.
as well as the cardiologists.
Hmm.
And CT scan is a non-invasive procedure
Mhm.
where also we can see the angiogram means seeing the vessel, the pipelines. You
Correct.
remember,
Yes.
we see the pipelines through Doppler.
Mhm.
At the same time, we see the pipelines through the CT scan. We see in a very powerful way
Correct.
these pipelines through the CT scan.
True.
So CT angiography is a specialized CT scan. And
Mhm.
you asked about CT coronary angiography.
Yes.
It is a further more specialized thing.
Correct. Right.
So would you want me to tell about this?
So, based on this, we have one question.
Yeah.
How heart blockages can be detected without angiography?
Yeah, it's a very important apt question. Actually, I was going to come to it, but
Yeah.
our viewer only has asked. So very nice. Thank you for the question. Actually, yeah, my thing is, 2 days back, I was working in the department, and 32 years old male, person, rushed. He was rushed to the emergency department by his, parents.
Mhm.
Parents, and he was having severe acute chest pain.
Okay.
Immediately, our emergency medical officer, he took note of it, and he did all the ECG and TROP-T and other tests,
Mhm.
and he was found positive for acute ischemic attack, heart attack, MI, myocardial infarction. Then he was immediately rushed into the cath lab, where the cardiologist tried to save him, but unfortunate for the patient and for the relatives and the family and for us that we could not save the life.
Mhm.
So this is a sad story, but this is very important for us to ponder upon, that even in the early 30s, people are dying of heart attack. What is the
That's
cause? The cause is the lifestyle, the
sedentary lifestyle.
stress. The stress levels are gone to a very high level. The corporate culture is becoming cutthroat competition, rat race, and the eating habits are like very, I mean, all the junk food and the fast food and everything like that. And then you don't have people who are exercising every day. sedentary lifestyle, as you said, and genetics. So all these factors combining together, they are causing so much of health hazards, havoc in the society. No, you cannot imagine that parents losing a 32 years old son, the only son, because of a heart attack. What do we have to combat or to uh, offer fight to this disease? We have a very very powerful tool, powerful technique. It is called as CT coronary angiography. Here what happens is, because we already know that these factors are there in the life of that patient, we proactively screen the patient. Maybe 2 3 years, maybe 5 years, when he starts having these complaints, maybe that day where he starts having, say, he starts having stressful life, or all the factors that I just elaborated. And what happens is, when we screen this patient on a CT coronary angiogram, we get to see the blockages, real time blockages. And if it is 30%, 40%, or 50% blockages, we can stop at that point. We can intervene at that point. We can tell the patient, you have to change these 10 factors so that your life will be saved. So our topic today of discussion is early detection saves lives. It is not about just the scans. It is not about the computer, the machine, the scans, the billing, the cost. It is not about that. It is about a life. Are you able to save the life? I'll just give you one example. Our own hospital, there are 30 hardworking, sincere, guards who, they guard our, hospital. They are security guards. Yeah. So we thought that when this modality came to our hospital, we thought that why not to start with them, because they are our very important person, very important people. And we screened those 32 people into the CT coronary angiography. To our surprise, a majority of them got blocks, and 3 of them, they got more than 90% blocks. One of that guard was having a 99% block. Even a single step of exertion and his life was gone. We took immediate steps of taking that patient into the cath lab and doing the necessary things, and we could save the lives. It is all about saving lives, whether it be a radiologist, a cardiologist, a pulmonologist, emergency medical officer, or anybody, or even the supporting staff. Even you and me, we are all doing whatever efforts we are, this live telecast, this podcast, and everything, just to save the lives of people, to make the life better,
To create an awareness about.
to create the awareness, because you see, the beneficiaries should get the benefit of the services. We see this medium by through which we can reach out to you, the viewers, through this medium, that please take charge of your health. Don't ruin your health. Nowadays it has happened that people have least interest in health because they don't have time. But when the time goes away, goes past that bar where we cannot reverse it back, we should take charge of our health. Yeah.
Correct. Now, let's talk about PET CT scan.
Yeah.
So, PET CT scan sounds like something, a very hi-fi technique. So, what does it do actually, and in what conditions is it most useful?
Okay. So PET CT is another type of a CT scan only. Basically, along with the CT scan modality, we also inject one radioactive material, as well as a FDG glucose material, where when it is injected, along with the morphology, the organ function is also detected. Basically, it is used for cancer patients, where all the cancer has spread in the body. So PET scan is very useful for those patients.
Okay, right. So we also have recently launched the PET CT scan at Bhaktivedanta Hospital also. So requesting our participants to check on the bottom of your screen, we have mentioned 24/7 dedicated contact number to reach out for the healthcare needs and certain topics which we can go live through your congregation. Also, the contact information is mentioned to organize such events as well. Also, you can see on the screen the ISKCON Devotee Healthcare Services poster, wherein we have mentioned 24/7 contact number. You can reach out to us for the same.
Do you have any questions?
So let's move on to the next question, sir. We have asked on by the viewer,
Okay.
for which radiology procedure a contrast dye be used? If yes, what are the side effects?
Which procedures we use a dye?
Yes,
Yeah. So first of all, which procedures are used, and then I'll elaborate on the
correct.
side effects.
Yes.
So basically, as I told you, CT has two types. One is a plain CT scan, one is a contrast CT scan.
Correct.
For the contrast CT scan, we use the dyes.
Mhm.
Also, for procedures like X-ray procedures, like a ureterogram or then HSG, histosalpingography. So basically, there are medical terms. I'll simplify for the viewers.
Correct.
For enhancing the CT scan, we use the dye. And for specialized X-ray procedures, where, for example, person is suffering from a urine infection and not able to pass urine properly, we inject the dye. For a woman who is suffering from infertility, to see the tubes are intact, we use the dye. For people who are having a swallowing problem, we use the dye of oral dye of barium, and then we use the barium swallow procedures. So all these procedures we use the dye.
Correct.
And what are the side effects of the dye? They are not much. Actually, if our serum creatinine, that means our kidney health is good, and if you maintain a good hydration after the procedure, it should not be a problem. Your dye can be very safely excreted out of the body. So, and potentially, if the dye is injected more and the kidneys are not in the proper good health, the dye can affect your kidneys.
True.
Yeah.
Correct. So now addressing to some common fears and misunderstandings. Many people worry about radiation exposure from these tests. So how safe are they in reality?
In radiology, when we enter, the first rule which we are taught is the risk benefit ratio.
Risk benefit ratio. Okay.
So risk, yeah, definitely radiation, yes, not good for health. But what is the benefit? If we just avoid radiation by saying that okay, it is not good for health, and just keep harboring the disease in the body,
right,
then it is not at all good thing. So yes, radiation has some medical hazards, but the benefit ratio outweighs very more than what the risk is. So radiation is not a problem if you are getting screened for once or twice in a year, not at all a problem. Also, there is very important modality which I did not mention up till now, that is called as MRI, magnetic resonance imaging. Correct. It uses the magnetic properties of the body to formulate an image. Correct. And this completely avoids the radiation. So those who are able to undergo MRI, they are advised to undergo MRI, like MRI brain or spine or joints. Right. So I would like to tell the good news to all our viewers that in Bhaktivedanta Hospital, a state-of-the-art 3 Tesla MRI machine is being installed currently and will be functional in a few weeks. Correct. So that all our patients and viewers can take proper advantage of the modality.
Correct, right. The other common fear is some avoid scans due to the cost or maybe the lack of awareness. What would you say about the value of early detection for the long run?
Definitely. So as I mentioned about CT scan, I mentioned about an X-ray, as well as I mentioned about sonography. These are very ultra high-tech modalities where lots and lots of research has gone, and especially the Western scientists are involved in it, as well as the Western countries involved in the manufacturing of the machines. Correct. So all these factors taken together increase the per scan ticket size or cost of the patient. Right. That's true. But if we look at it in a different point of view, where, yeah, of course, we talked about the importance of life. Yes. But then what about the importance of, saving lakhs and lakhs of rupees by getting admitted in the hospital, by becoming more proactive? So, yeah, the cost is there, but the cost benefit ratio always, again, that was risk benefit ratio. Yeah. The cost benefit ratio is also outweighs a lot.
Hmm.
So yes, the cost is there, but please look at it into giving yourself a very good gift,
Correct.
yourself and your dear ones.
Right, right, true. We'll take the next question.
Yeah.
What frequency do you recommend mammography as a preventive measure?
Yeah, we I think already discussed this,
Yes,
that yearly once a mammogram has to be
yearly once. Okay.
undergo,
Mhm.
and after the age of 40 years.
After the age of
Yeah.
40 years. Okay, right. We'll take the next question. For someone who has never done any scan, where should they start?
Yeah, because someone may claim that, oh, I'm healthy, I don't need a scan and this and that.
Yeah.
So yeah, actually in this age of uncertainty
Hmm.
over the health, especially the modern lifestyle and altered habits and all,
Right.
one should, if one has not undergone any scan before, one should undergo a whole body health checkup,
Correct.
which includes the blood tests as well as the radiology tests.
Hmm.
So a basic chest x-ray
Hmm.
as well as a sonography of abdomen
Right.
we can start with,
Okay.
which will not cost much also,
Hmm.
and which will give us a very high value of our body, the insights in our body.
Correct. Right.
Yeah,
So you mean to say should scans only be done when there is a problem, or there are some preventive scans also which are recommended?
definitely. Why to wait when the body starts screaming, I say? Why to wait? This is one more fascinating thing about the body, which fascinates me and all my medical fraternity every day.
Hmm.
The body is such an amazing machine created by God, Krishna,
True.
that it tries to heal itself
Hmm.
whenever the disease is there.
Correct.
And we falsely may get the signal that okay, everything is all right,
True.
but the body also gives some soft signals.
True.
Something is not well.
Hmm.
My stomach is upset. I have some feverish sensation.
Correct.
I have some weakness today. Why I am feeling fatigue today?
Hmm.
My headache is very constant now. Why there is recurrent headache?
True.
Why there is hair fall? Why there is pain in the legs? So
Hmm.
these are very soft signals.
Correct.
We should pick up these signals
Hmm.
and we should undergo this test.
Absolutely, sir. Now, regarding varicose veins,
Yeah.
many people have some visible veins or swelling in their legs. How can radiology help to early diagnose, and what will be the line of treatment for varicose veins?
Definitely, very important question. So what happens is, you see this varicose veins means visible veins are there on the leg. So people, they just ignore it, saying that okay, it is there just superficially, it is not inside, and there is no problem.
Hmm.
But actually, these varicose veins are deep seated.
Correct.
They arise because maybe different reasons are there: long standing job hours, standing job,
Hmm.
or traveling, you stand 1 hour standing
Right.
going and
Right.
coming.
Yeah.
And then some housewife is there, housemaker is there, who
Hmm.
is standing a lot. And these veins,
Hmm.
they dilate because our entire system of the body
Correct.
of returning that blood from the legs into the heart
Hmm.
is damaged.
Correct.
So through a Doppler test in the
Hmm.
department of radiology,
Hmm.
what we get to know is that these varicose veins are in the early stage or in the advanced stage.
Correct.
If they are in the early stage without any surgery, without any operation, you can treat it.
Correct.
So all the while I get this question,
Yeah.
sir, will it be resolved without operation, without
Hmm.
surgery?
Hmm.
So my answer is, if you come early and give yourself the gift of proactive preventive scan,
Correct.
we can resolve it without any surgery or operation.
Absolutely. Absolutely. Uh, we'll take the question from our viewer.
Yeah.
Is there a facility of full body checkup service in Bhaktivedanta Hospital, which includes radiology services?
Definitely it is there. Our health
Checkup
health checkup
packages.
department is very active, and we have different checkup packages.
Yes.
We have cardiac package, we have full body package,
Hmm.
and we have women's package, men's package, and we have entire things, and that includes blood tests, radiology tests, cardiology tests, pulmonology tests,
Exactly.
as well as consultation.
Hmm.
So please do come to Bhaktivedanta Hospital for taking advantage of these packages.
Correct. Right. So, is it okay to get multiple scans done in a year if you have any chronic illness?
Yeah, This also is an important question. So again, we will evaluate the risk benefit ratio.
Yeah.
And if the physician says that this test needs to be done, we'll try to our another principle in radiology is alara, as low as reasonably achievable. Alara.
Okay.
Alara principle.
Mhm.
So we will use this alara principle, and we will try to image that patient in MRI or ultrasound as much as possible, and try to restrict the CT scan as less as possible. But 3 or 4 times in an year for a chronic disease is not at all a problem.
Correct. Right.
It's not at all a problem.
True. Absolutely. Uh, Next question is, what are the innovations or different horizons in radiology that excite you most?
The entire department of radiology, where the modalities which grow day by day, there is one new thing that is coming every day in the field of radiology that excites me every day. But if you say I am more excited by an ultrasound or a MRI, where without any radiation we are able to see all the functionalities of the body.
Correct.
And also the CT scan, where with a very low dose radiation we are able to see the entire body.
Correct.
Yeah.
Again, we have one question, sir. What's the difference between a regular CT scan and a PET CT scan?
Yeah, that's what we discussed also.
Yes.
That a PET CT scan, we give a different kind of dye, which is called as FDG,
Correct.
fluorodeoxyglucose.
Yeah.
So there, it is used to see the function of that organ, especially used in cancer treatment,
Right.
where the cancer, if the cancer has spread from one organ to the different organs, that can be seen in a PET scan.
Okay, right. So requesting again our participants who are with us from the starting, check on the bottom of your screen. We have mentioned 24/7 dedicated contact number where you can reach out to us for your healthcare needs. Also, the contact information is mentioned to organize such kind of events for your congregations. Also, you can see on the display of your screen Bhaktivedanta Hospital's initiative, that is ISKCON Devotee Healthcare Services, our offerings, which has special health talks and webinars. The contact numbers, 24/7 helpline number for ISKCON community, which can be used to book an appointment on priority basis and to felicitate the emergency or any other medical queries. Also, we have the QR codes which are being you can see on the screen. You can scan the QR code. You can get more information about Bhaktivedanta Hospital, and also you can join the ISKCON community through this QR code. So now the next question is, if any trauma case which comes to Bhaktivedanta Hospital, what is the first step of the radiology department to have? Because traumatic cases, of course, it requires some X-rays, then requires some CT scan. So how is the journey when a person arises or he comes to Bhaktivedanta Hospital with a trauma case?
Very importantly, because the trauma case, patient's relatives are already in
panic.
anxiety, they are
Yes.
panic mode,
Yes.
and the patient is also bleeding internally. There are multiple fractures.
Correct.
Our emergency team is very, very effective and very efficient.
Right.
They will quickly check the vitals and examine the patient. They will quickly send the patient into the CT scan, where head to toe CT scan will be done.
Right.
All the multiple fractures will be enlisted for the surgeon to be taken care of. And if the internal bleeding is there, how much is the bleed, what organs are damaged, what is the severity of that damage, will it be requiring a surgery or can it be conserved without surgery, and what will be the prognosis of the patient. All these things are very clearly depicted by a CT scan. After a CT scan is done, our provisional report goes to the emergency department, where the emergency people, they try to involve all other specialties wherever needed. Like for example, if the fracture is there, they ask for orthopedics help. If there is some internal hemorrhage or bleed in the abdomen, they ask for the surgeon's help. And if required, they take the patient into the OT and they do whatever is needed to save the life of the patient.
Correct, right. We'll take the next question, sir.
Yeah.
Please explore more about ultrasound technique.
Yeah, very nice question. Actually, I was expecting this question because our ultrasound discussion was not complete.
Yeah.
Our main focus now is on the metabolic syndrome patients, where patients are suffering from diabetes, blood pressure, hypercholesterolemia, or obesity. So these problems are quite oftenly seen
Hmm.
in the current scenario, current population.
Right.
So what we do is we have a liver elastography scan. Very important. It is an ultrasound scan only,
Mhm.
but a specialized ultrasound scan.
Mhm.
The liver is the part of the is the center of entire metabolic syndrome,
Right.
because liver is this organ. So basically, why these lifestyle problems have come? Because we whenever we eat junk food or food which is more of fat or a very bad kind of bad in the sense of all the fat content and junk content,
Mhm.
the food which has gone into the intestine
Mhm.
is filtered by liver first.
Correct.
The liver is the first recipient of all the insults that we eat. Our tongue enjoys, but the intestine and then the liver,
Hmm.
they just pay for that test.
Actually, yeah.
So the liver gets damaged because of the fat content, and the liver becomes fatty.
Correct. Right.
We call this fatty liver.
Mhm.
Why the fatty liver is important? Because that fatty liver can get converted into fibrosis,
Correct.
and they cause diabetes, they cause blood pressure, increase in blood pressure, or even heart attacks.
Right. True.
So that liver needs to be screened. So ultrasound technique helps us in doing that.
Hmm.
Secondly, the visceral fat, it is not the fat which is visible on our body, it is the fat inside the abdomen,
Okay.
which is dangerous.
Mhm.
The thickness of that fat can be estimated by an ultrasound.
Okay.
Thirdly, ultrasound helps not only in this liver and fat things.
Mhm.
Ultrasound helps in even the evaluation of the our muscles and joints.
Correct.
So if someone is having pain, not that directly they go into the MRI.
Mhm.
Many of the joint and the muscle problems can be resolved in an ultrasound level also.
Correct.
Ultrasound also helps in color Doppler is a specialized technique of ultrasound only.
Hmm.
So ultrasound helps in estimating the elasticity or stiffness of the arteries also.
Correct.
So
Right.
arteries health can also be evaluated by an ultrasound. So
Correct.
ultrasound is a all-rounder, I'll say,
Mhm.
because it is low cost,
Correct.
it is easily available,
Mhm.
and in the expert hands, it is it is like a boon to the
Mhm.
patients.
Correct. Right. So when you spoke about the liver, fatty liver thing, so fibroscan. So can that detect fatty liver along with some cancerous thing?
Definitely, actually, fibroscan is nothing but liver elastography.
Correct. The
Huh.
same one.
Same thing. So it not only detects the liver health condition, but yeah, liver cancer is a specialized thing which can be detected by an ultrasound, a
Mhm.
Doppler,
Correct.
as well as an elastography.
Okay.
So both all the three things are helpful in detecting the liver cancer. Yeah.
Correct. Right. We have one question. Does USG helpful for varicose veins?
Definitely.
Color
The
Doppler.
color Doppler. Yeah. Now you know it. So, yes, varicose veins are easily detected by an ultrasound
Mhm.
in the expert hands. As I say,
Correct.
that the early detection of the varicose veins is very, very important, because we can save ourselves from lakhs and lakhs of rupees of the treatment.
Absolutely. Absolutely. So as the time is tickling, just one last question,
Uh,
and definitely we would like to hear a last word from
yeah,
you.
yeah, definitely.
What's one message you would love everyone to take home today about early detection?
Dear viewers, don't take your health lightly. Please gift yourself this very wonderful gift of preventive scans,
Hmm.
and please make use of this modern technology which will keep you healthy always. Please note that this early detection is going to save countless lives. So together with all of you,
Hmm.
with the help of all of you, let us build a society where we detect these diseases, these demons. They are causing problems in our body.
Of
They
course.
are preventing us from living the best potential of our life.
Correct.
Let us hold hands with each other and prevent these diseases by proactively coming to the hospitals and
Right.
departments of radiology, like Department of Radiology, Bhaktivedanta Hospital, and getting yourself these scans done and detecting these diseases early, so that we save countless lives.
Thank you so much, sir. So I really thank our today's speaker, Dr. Ankush Govindar, and our streaming partners, Hare Krishna YouTube channel, and also to all our participants for joining in this today's podcast. So we'll also meet you in next month with an exciting another health topic with some another speaker from Bhaktivedanta Hospital. So till then, just take care of yourself and take care of your family. Hare Krishna.
Hare Krishna.